I wanted to share this second clause
I,
of the reproductive health bill, which deals with access to family planning services, which also has been an issue to most people. The reason why I do not know. So, can you? What do you understand by this clause, the second clause, the access to family planning services? What does it offer? What? Yes, what does it offer as a clause? What does it propose?
first of all, as I said earlier, the bill does not introduce any new rights. It just realizes the rights as contained in the Constitution.
The Constitution,
So
yeah.
when the Constitution says that everyone has the right to the highest standard of health, including reproductive health care, a key component of right to choose for yourself how many children you want to have, whether you want to have children in the first place, and what kind of spacing you want to have for the children if you decide to have children. So the bill then realizes that by saying that everyone should be able to access contraceptives. And the truth is, so long as you are sexually active, when you are engaging in sex, there's always a risk of getting pregnant. So then why are we saying that it should be okay for people to get pregnant when they don't want to get pregnant? So the issue around that clause is providing for people who are sexually active to be able to get contraceptives that they need in order to delay or in order to stop pregnancies that they don't want.
The
Yeah.
problem with this one, they were saying, it's that it encourages the young people to be mischievous, yeah, to partake in immoral sexual activity, which was happening anyway, which would happen even if this wasn't introduced, right? So my thought was, why have such a pushback on this? Well, the gospel of abstinence has been preached over the years. Yes, it is practical to some level. It is. I do not disagree with abstinence. It's a virtuous thing to abstain if you can. But as seen with the statistics, the years, cause take out COVID, just take out COVID. Even the years preceding this COVID pandemic, there were cases of teenage pregnancies which were in large numbers. Not only this year, but this year because most young people, teenagers and the youth are at home, the cases increased. But that does not mean that before there were no cases. Now, saying that this promotes promiscuity, no, not promiscuity, they're not married, they're young people. This promotes sexual misendeavors among young people. It just seems off to me because if you look at the statistics, teenage pregnancies, they were there before even this was proposed. And to me, this was just a way to try and mitigate. If you can't try to mitigate some of these cases, I would like to hear what you think about the value or the devaluation of this clause of the said bill and why people are so much against it and what can be done. So I'd like to hear what your take is. Yeah.
I think the first thing we need to agree as a country is that we are hypocrites. We
100%. I agree with that. 100%.
we are a nation that says we love the Lord, we have values, but sometimes you wonder what kind of values we have as a country when those values either to protect young people, to ensure that young people grow up in a healthy manner, that we have access to education, access to good healthcare system. We say we are a country of God, yet we are among the countries, I think, that have the most scandals, corruption cases, land grabbing. I mean,
don't start me with the
all of
corruption.
these things, and yet and now when it comes to young people accessing family planning or contraceptive, we are suddenly like, oh no, that's where we draw the line. Really? I mean, it's just I just can't understand the level of hypocrisy. Then, having said that, the bill does not introduce contraceptives. I think I can't overemphasize this. This bill does not introduce any new rights because we already have the National Adolescent Sexual and Reproductive Health Policy of 2015 that provides for access to contraceptives for young people. We already have an health act that defines what kind of services young people need. We have national guidelines for provision of youth-friendly services of 2016 that says young people should be able to access contraceptives. As early as the year of our Lord 2009, we had the National Condom Strategy. It was developed in order to curb the high rise of HIV/AIDS. So this bill does not introduce contraceptives, and I think it's important that we understand that. Having said that, the key thing is that for especially this is now for poor young people, for young people who are coming from disadvantaged backgrounds, is that they will not be able to access such services at all, because people with money, for example, if you have money and you go to a big hospital, there's no one there who will deny you services. The people who will be denied services are the people who go to the local dispensary and the local health center, because the law and is very, very need to ensure that at the end of the day they get the services that they need, so that they are able to be protected from issues such as teenage pregnancies.
Are you still there?
Can you hear me?
Yes, I can hear you. From my point of view,
Yes, I'm here. Can you hear me?
Yes, I can hear you.
Oh, yeah.
In my point of view, I believe, or I think, not believe, I think that most people are against this bill because of society. Because for me, I understand the implications of the bill, what the bill proposes, and as you have said, it does not introduce anything new. It's just reinforcing what's already there and making it stringent so that most people, a lot of people who are now not accessing these services can access them. But for me, if my parent is against this bill, if I'm a teen and both my parents are like, no, this bill is bad and so forth, because it has been castigated by the church or some people in the society, major people, they'll be against it. And because of that, I will also be against it, even though to some certain degree I understand what this bill says, what the provisions are. But if you're in a mob and most people are leaning right, you're not going to lean left. You don't want to be left out. And that sense of communal belonging is what leads most people to go, oh, okay, I'm just going to lean left with this, or right with these people. I'm going to speak out against this. And until people just understand the value of progressive thinking, I believe we shall have more problems like this, in case other bills that are to help people, but certain key people in places reject them. I think such problems we will face such problems in future, not only to such a bill or something, and not only to such a bill, but also to other things that will be introduced which are beneficial, be it bills, be it laws, be it services, whatever. I believe that, from my point of view, that is one of the major things that has led people to disagree with this bill. And as you had said before, if you look at most people, they actually do not know what this bill is about. Most of them, they just hear from people, and since these people they have a pull, or they influence the general structure of what is around them, the community, the belonging of the people, they're like, okay, I'm just gonna go along with these people no matter what they say. And this bill will be met by a lot of hindrance, because I have talked to friends of mine. They understand what the bill say. When they're with me, they're like, this is a really good bill, it will help us as youth. But once they go back out there among their community, among their parents, among their fellow church members, they're like, no, I don't support this. This is immoral. It's against whatever the church propagates. So for me, that is what I think is one of the stumbling blocks, the mentality of the people, and changing.
Yeah, so I was saying there's a major disconnect between, for example, what young people want, and as you've said, what our parents, our caregivers, and the elderly people want. And you mentioned something that I think is very, very important, in that I don't think there is any young person who goes to their parents and say that now I want to have sex, I want to start having sex, or I actually had sex yesterday. And if you
Oh,
ask
that is
most
mad.
parents, yes, if you ask most parents and ask them, do you think your child is having sex? They will say, no, 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 my child can't be
Hey,
having sex.
Johnny Wangu.
Yeah.
Never.
Ever, yeah.
Uh-huh.
So then you have a case whereby, I mean, sometimes when we talk about young people, it appears as if we're talking about abstract people or people who are not here. You know, so
Mm-hmm.
if you ask a parent, for example, they will say that my child is not having sex, and therefore,
Holy.
because my child is not having sex,
Uh-huh.
yes, my child is a church boy. Therefore,
Mm-hmm.
my child does not need condoms. But if you
Mm-hmm.
ask the child of course knows very well that they are having sex and knows
Yes.
very well that they need access to condoms. So
Such
it's
contraceptives,
also
yeah.
very important that we destigmatize the conversation around sex and sexuality. I know it will take a very long time, but there needs to come a time whereby people can actually be free to not to talk about how they're having sex or who they're having sex with,
Oh,
but at least to
definitely
have
not.
some sort of
Uh-huh.
to have some general conversation, yeah? Because
Yes,
they, they,
general
they, they say
conversations,
they
yes.
say charity begins at home.
At home.
Yeah, charity begins at home. So that
Mhm.
is the first place that people need to have these conversations, and
Okay.
these conversations are very hard conversations, and we also need to see how can there are some parents who want to have these conversations with their children,
Mm-hmm.
but they don't have that capacity. They don't know even what to say. So it's
Mm-hmm.
important that we also find ways of supporting parents to be able to have these conversations
Okay.
in a very friendly manner, in a very truthful manner, in a very candid manner, and in a manner that actually is also very comfortable to them and to the children as well.